Good afternoon and welcome to United TV. This is our Bariatric Friday, and my name is Kemal Erkan. I have Dr. Isaias Irgau with me. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Glad to be back for yet another Bariatric Friday.
Well, thank you for being with us. So, as usual, every week we discuss different topics around the morbid obesity issue and how we are getting our patients ready for the surgery, as well as those who are dealing with the morbid obesity. This is a place that they can learn and understand more about this chronic illness. So today we are going to talk about social stigma of morbid obesity, as well as sexual well-being and dealing while you are dealing with morbid obesity, and what are the things that you can do going through the surgery, and what are the benefits that you would be having, so then you can go back to your life and live a better life. So, Dr. Irgau, we can start with the social stigma from your side. You see patients every day. I'm sure they share a lot of things with you, a lot of private things, and there's probably nowhere to go other than coming to a bariatric surgeon in those cases. But what are the things that you are actually hearing from them? And then we'll discuss the issues in the community a little bit.
Absolutely. We think we have made progress, Kamal, in terms of getting really out the message that obesity is a public health issue. It is a chronic disease, but we're really far from really completing the task in terms of really creating awareness in the society. And the reason I say that is because the stigmatization of obesity persists, lingers, and it's reflected in the levels of isolation and depression that you see in individuals who struggle with obesity. And I believe this comes from a fundamental misconception about the nature of obesity, right? The vast majority of people within the society attribute obesity as an issue of personal responsibility, right? They are not good, they are lazy, they are this. That's why obesity is apparent, right? Far from it, obesity actually is a very complex disease, the result of complex interactions that include genetics, that include biology, and of course the environment as well. Clearly, the influence of the environment in the epidemic of obesity cannot be denied, of course, right? Our environment has changed significantly over the last 50, 60 years in terms of availability of cheap calories, in terms of discouragement of people from being physically active because of excessive automation, right? Those are real factors. And yet, it is the biology, it's the genetic makeup that decides which people will struggle more with obesity than others. I can tell you that we all know individuals who may pretty much live the same type of lifestyle, and yet one of them will be struggling with weight and the other person will not. So the difference really is their biology, their genetic makeup. So not understanding this leads to people pointing fingers towards people who struggle from morbid obesity, creating the stigma, right? And this stigma has consequences, right? Because it leads to low self-esteem, it leads to isolation, it leads to depression. And guess what? All these factors actually reinforce and encourage more obesity. They don't discourage it. First of all, by really discouraging people from seeking treatment, right? And secondly, isolation, depression by itself leads to behaviors that will encourage more obesity. So the stigmatization is not known only something that is hurtful and harmful to people who struggle with obesity, but it's actually a major obstacle to when people try to get rid of the weight.
Sure. And this comes with a lot of psychological issues, right? When these people have to deal with the chronic illness itself. On top of it, now we have other issues following them, and psychological impact of these behaviors are extremely hurtful. And there's also some, I think, Dr. Irgau, just like knowing, like being in different places, different cultures. Uh, I think we are maybe, we as in the United States, we are at a much better place than like places in Europe and other places. The way that these name calling is still happening. But I'm traveling, as you know, today, and I know one of the first things that they will make comments about is whether I lose weight or I lost weight openly in public. So, and then I see people on TV. I mean, on our side here as well, but I see it with very openly that they discuss someone's weight, and they're not nice about it. They're either making fun of it, or they're insulting them, or they are criticizing them. So, and that psychological impact of that can be extremely harmful for that individual. And as you said, this is the biology. It's not the standard for everyone. So you and I may eat the same thing, but we are going to process it differently. And this is not just because I walk less than you do or you walk less than I do. It's because our biology is different. And this is, if someone believes in modern science, they would understand our genetics and our the way that we are built is not the same. Of course, this is going to be very important from that point. Now, from the like how we are able to actually fight with the stereotyping, do you have any suggestions for those who are kind of the victim of it and those who are actually participating in those or initiating?
Absolutely. Yeah. I mean, it is, at the end of the day, it's education, it's understanding. As I say, the fundamental problem is misconception, right? So-and-so is looking like that because, it is their fault, right? There is this stereotyping of associating size and weight with level of intelligence, with character, with moral standing, which is far from it, right? And you see this reflected very often in even discrimination that people have to go through because, you go to an interview for a job, and if this misconception persists, and if you happen to struggle with obesity, the moment you open the door and sit down in that interview slot, you've lost a lot of points because of this misconception, right? You lose ground just because of that, right? So that stereotyping is not, as we said earlier on, not only hurtful, but it costs people a lot in their life, in their career, in many aspects of their daily living. So it is very important that society takes this on, and education is key for people to understand that the key driver to this problem is the genetic. It's just like, why does somebody have type 2 diabetes or develop a certain cancer or they develop a certain illness? We don't go on saying, you are the one responsible for it, therefore, no, we say it's a disease. We empathize. We show compassion. We don't do that when it comes to obesity. So getting rid of this misconception, I think, will lead to people understanding, to empathy, and that will open the doors not only for people to have less suffering because of this stigmatization, but also we will be able to lift this and let people get access to care, right? How often we talk about the fact that bariatric surgery currently is the most effective treatment we have for severe obesity, Kamal. And yet, what percentage of people who struggle with this come forward to us? Even when they decide to come forward, how long does it take them to actually make that call, to visit our website or to make the phone call, right? That is a barrier that is created by this stigmatization. So there is a heavy cost to this stigmatization. And I think shows like Bariatric Friday are important from this point of view because we are talking about this as professionals to educate people that obesity is a disease, it's a chronic illness. There is a complex set of factors that drive it. That is not just an issue of personal responsibility. It is really a public health problem.
So one of the maybe my own struggle with this issue, people, I mean, the social stigma is there, right? So this is already part of the society that we live in. So it's not something, and it's going to change. It's going to be hopefully better, but it's going to take time. But those, our issue today is not just necessarily, talking about that, but also, let's say if I'm the individual who's being targeted with the social stigma, in some cases, maybe we do criticize people who don't take actions to fix the problem too. So I think there's this kind of like fine line between entitlement that comes from this disease versus what do you do to fix it? So, or should I be part of you not taking any decision, making any decisions on the issue that you have? So,
that's an interesting point, Kamal. But remember, the person who's struggling from obesity is also part of the society. So that person themselves actually is looking at it from that point of view as well, right? So the idea of I should be able to take care of this myself persists, right? So rather than countering what the society is doing to you with the stigmatization, you actually join the society in blaming yourself. And therefore, you don't see a value in the treatments that are being offered because you yourself are actually a victim of this misconception, I am responsible for this, therefore I should be able to fix it. Well, guess what? No, you can't fix it. Yes, the environment where you are living is important, but that is what it is. This is the environment where we are, right? We are surrounded by plenty of stimuli that continuously, catch our attention. And there are biologically driven mechanisms in our body that are designed for us to focus on this, whether they are foods, calories, and other things, right? And then on top of that, we live in a society where physically it's impossible for you to be active. I mean, you and I live in Delaware, a very suburban place. I mean, how can you go and walk to go to the store or somewhere? You cannot even find walking paths, right? You have to drive anywhere and everywhere. You have to take a bus. If you can't, if you don't have a car, but you cannot do it yourself. So unless you go out purposely to walk and to do things, the environment where you live is actually all designed for us to really not to become active at all. So excessive availability of calories, lack of physical activity with a biology that is preferential towards weight accumulation results in obesity. In fact, sometimes when I think about this, Kamal, I even wonder why obesity is not even more prevalent than what it is, right? Where we have this combination, right? So this is what it is. So even the person who is struggling actually looks at it through this misconception, and that's why they take so much time to seek treatment, Kamal.
so I follow you there. So I guess the trouble that again, and because I listen to a lot of people, I follow a lot of social media accounts. There is the presentation of this issue of entitlement. Okay, so now do I need to pay or do I need to buy extra tickets versus others should also suffer? And you listen to them, one makes kind of sense for 1 second, and then next moment something else makes more sense. But I think what you said is, everyone is being part of this society, and everyone is going through this together. So everyone brings something more or less, and we have to kind of work on this together to fix the problem from the positive perspective. So,
No question, Kamal. I mean, just to add to that, I mean, once you look at it as a public health issue, then the public, the society, has to address it appropriately. So if room and space is necessary to accommodate people who are struggling with this, then society has a responsibility to do that. It cannot leave people behind just because they are struggling with something that does not fit in where others do, right?
mhm.
We have, and that empathy will come only if we understand the root cause of obesity. If we continue thinking that this is just a question of one's own personal responsibility without considering all these complex factors that are really interacting to create that situation, then we will leave people isolated, right? And to continue to suffer. And that will be perpetuated to the extent that, it will get worse.
Mhm.
And guess what? People will not seek treatment either. That's why it is important for us to be publicly aware that this is a public health problem.
So I think one of the other issue that I now kind of remember what I was trying to say earlier is there's this reaction to issues when someone or some people are trying to promote being morbidly obese and being healthy and happy, and then they're kind of exposing themselves as like, here how I'm doing, and this is my new norm. So then that's one of the issues that probably I have, because those
Absolutely.
are hurting everyone
Yeah.
else who are going through that problem in the society.
Yes. Yes, absolutely. I think that is counter, right? Because if you're celebrating something that is harmful from a health point of view, that has to be confronted, that has to be called out. Come on, there is no question about that.
So that actually, yeah, that was kind of like, that's why we were kind of always struggling. So why is this coming up? It's because someone else is promoting. Um, so, and I know we have covered the social stigma in other sessions before, and I know it's going to be a slow process, um, but we'll be here to support and educate those who are looking for more help. Now, this time, Dr. Guy, I kind of merge our sessions into two, and well, two sessions into one.
Mhm.
And sexual well-being is one of the issues that also people who have morbid obesity, they are struggling with. Now, again, we discussed this in our other sessions, but the problem is, a lot of people, they still don't know what's available there, what issues they're having. Are they the only one who are going through those issues, and are there solutions? So, in fact, yesterday, one of our surgeons, or the day before, mentioned something in our weekly meeting, which was kind of also important. Um, a lot of people are missing out. In the world of morbid obesity, they're missing out a lot of things that other people are able to uh, naturally have and enjoy. So, and sex is part of that.
Mhm.
And uh, we know there are issues, we know there are physical limitations, because when we say morbid obesity, again, for those who may not know, we are talking about BMI 40 and above. And that comes with a lot of
Mhm.
weight. So, and the physical limitation issues with how you feel about your body and whether or not you want to actually, uh, you're comfortable with yourself. So then you can go out there, or you can be with whoever you are with.
Mhm.
You can have these. So these are all issues. So from the actual life perspective, you have patients, you go through those patient visits every day. What are the things that you hear from them, and how you are helping them?
Yeah, I mean, the classic way in which this is expressed is somebody who is struggling with obesity. They will say, you know what, I haven't had a partner for X amount of years, right? All they will say to you, you know what, I am actually not comfortable exposing myself to my partner, suggesting that there is that level of frustration right, when it comes to obesity. And as you said, part of it is physical limitation, right? And you need to have a certain level of mobility and flexibility to have an enjoyable sexual life. If you are not able to have that mobility and flexibility, those are clear physical impediments. And when you struggle with obesity, that could be the case. But there is another side which is extremely important, and then this may be something that a lot of people don't know, and that is when we struggle with obesity, not only we are carrying extra weight, which is a physical burden to our body, but actually we are carrying cells that are active metabolically. These adipose cells, we call them the fat cells, Kamal, actually they produce substances that are very often responsible for many of the illnesses that are associated with obesity, right? And one of those substances are actually sexual hormones that are produced by the adipose cells, and that can create imbalance in the hormonal situation and the hormonal physiology of that person, leading to many consequences from a sexual health point of view, whether it is, decreased desire, decreased libido, difficulty with orgasm and satisfaction. These are real problems that can happen because of the hormonal imbalance that is due to the fact that there is excessive production of certain hormones by the excessive accumulation of fat. So in men, you could have, for instance, a very high incidence of erectile dysfunction, decreased desire, difficulty achieving orgasm. Similarly, in women, you could have, decreased desire, difficulty in arousal or orgasm, and very often also because of the physical limitations, pain during intercourse would be something that women can and would complain as well. This
So,
hormonal, go ahead.
so I just want to kind of, insert this here so that, like why people have sex, right? So the benefits of having sex. So then a lot of people take a lot of medications to see some of these benefits. So lower blood pressure, better immune system, so lower heart disease, improving self-esteem, decreasing depression, increasing libido, pain relief, and better sleep. So these are just like some of the top benefits of having sex. So when we are not trying to say here that, look, I mean, people need to have sex like, regardless of what it is. No, this is being who we are in our nature. This is part of us. And then that actually comes with benefits. So that there's a reason we do certain things in certain ways. Just like anything, there's a meaning. So these are some of the benefits of it. So when there is this chronic illness of morbid obesity, those who are not able to do what others are able to do, they are suffering. So that's why we are actually talking about it. So there may be people who are not understanding why we discuss this. Well, this is extremely important because this is our nature. This is part of us. So then every healthy being is or should have certain things in their lives, and sex is one of them. And as I mentioned, these are the benefits of just like the from the benefit side is an outcome, but then we have some other things that there are some damages on the sexual development. That's a different problem. But let's just focus on the benefits for now. So then when they're not able to have it, that's why we are discussing it with the solution to morbid obesity. Then we are hoping that they can actually see better results. But are they able to talk to you? Like the patients are able to tell you like comfortably what they're going through? Or are they, you still need to kind of go in and just try to, help them in different ways, or are they open about it?
Absolutely. So very many patients are open about it in that it is actually, maybe the first time in which they will have a safe place for them to really be able to express the cost of obesity in many aspects of their life. Admittedly, not everyone will be talking about, the difficulties in their sexual life, but it is a topic that very often comes up, right? And it comes up not necessarily just expressing how, there is little desire or libido or orgasm is difficult to achieve or interrupted, but in really showing the influence of obesity on self-confidence, for instance, right? Negative self-image, decreased confidence, feeling really inadequate, right? And that by itself leads to people really desiring it less or feeling so low in their estimate of themselves that they don't really volunteer, to situations where they would be having sexual encounters, right? So this, although it's not always apparent and clearly articulated, you can infer, that their sexual life is being affected and affected over many, many years, because it's, as we say, it's a chronic problem. It's not something that happened just last month. It is something that they have been struggling for most of their life, for most of the people that I encounter.
So, and again, just as a reminder, so the discussion is not just having sex, but actually sexual well-being and sexual health. So that actually starts from puberty. And we know that morbid obesity has impact on onset date of puberty. Can we talk about that a little bit?
Sure, sure. So obesity in adolescents actually will have a huge impact in their development, right? In girls, it can lead to early onset of puberty. In boys, it may lead to delayed onset of puberty. And those are things that will be apparent to the outside, because with puberty, there are physical changes that are apparent to everyone, right? And so, they compare themselves with their peers if they are boys, and there is delay in those changes that are occurring in their peers. If they are with girls, if it's happening a lot earlier than others, these are going to be obvious. And these are due to the hormonal imbalances, again, that are caused by excessive weight. So whether it's really early cycles that are irregular in girls, or early, development of breast tissue and other physical appearances, or delayed, appearance of the pubertal signs in boys, those will have an impact in their development to their mental health. And obviously, not to mention the fact that they will also be having some serious health issues, whether it's early onset of type 2 diabetes, high blood pressure, and other illnesses that are very often not associated with adolescents.
Sure. Now, like going a little bit uh, more from puberty to the time of menopause, and that's a really important time for a lot of women who know that they're going to go through that, but they don't know how, and everyone has their own uh, experience and their own challenges, and we know that morbid obesity also has impact on menopause. Um, anything
Yeah, absolutely. This is a transition period for women in which there are some important changes in their hormonal balances, particularly hormones like estrogen and progesterone tend to decrease. And these imbalances are actually further exacerbated with the presence of obesity. So some of the symptoms that are seen in menopause, whether it's night sweats, hot flashes, mood swings, and others, are exacerbated when we have the presence of obesity. These changes are very often associated with, decreased bone density, leading to thinner bones, more being prone to fractures. And those are obviously going to be exacerbated with obesity, which also can cause decreased bone density, but also the burden of the weight itself can lead to the bones being much less resistant to breaking and other accidents, essentially. But the interesting thing also, Kamal, here is that menopause itself could be a time in which weight gain could be accelerated, right? So you have a situation in which a person could be struggling with obesity to begin with, and maybe they were managing it so in terms of the increase in the weight until they get to menopause, and suddenly now it's out of control. The weight goes even higher, which means that it's going to make the symptoms of menopause even worse. So it's almost like a vicious cycle that women can be trapped in at the time of menopause. And it's no surprise that very often women will be seeking really treatment at this time of their life, because really it becomes almost impossible for them to lose weight after menopause.
So you mentioned earlier, we discussed a little bit erectile dysfunction. This is one of those taboos that many people don't want to talk about, but we know it's out there because we know from, let's say, even primary care setting, number of prescriptions are given for ED treatment.
Mhm.
The shots that's available, testosterone shot would be one. The connection between ED and the morbid obesity is clear. So we are saying that by losing weight, you can actually replace testosterone injections.
Mhm. Mhm.
So, and that's by itself is huge, right? A lot of people are getting those, and many people don't know that.
Absolutely, absolutely. Yeah. So it is not unusual for our patients actually to be on testosterone supplementation, and for them not to require that after they lose adequate amount of weight. So there is that aspect of hormonal imbalance that is really impacted by obesity itself, but also there are other factors, related to obesity, which could lead to exacerbation of erectile dysfunction, and that has to do also with the cardiovascular health of the person, right? In terms of blood flow and health of blood vessels. This is obviously made worse with obesity, because obesity itself does affect cardiovascular health. So treating obesity also will decrease this factor that could exacerbate erectile dysfunction.
Sure. So I know there are a lot more. Maybe we didn't cover, but I know in different sessions we are trying to touch different issues and going into some of them in more detail. So the challenge for us is we know like any problem, any in healthcare, anything that we want to kind of approach, if it's a straightforward problem, then you take care of it. So this is not like morbid obesity is not. Morbid obesity comes with so many different problems altogether. Not only it comes with other diseases, other illnesses, but it has a lot of other complications, uh, which is affecting our day-to-day life. It's affecting our psychological events. It's affecting our um, well-being from every different aspect. So the reason we are out here is for those individuals who are actually struggling with morbid obesity, fighting morbid obesity. One of the most efficient tool is the bariatric surgery. So this is a surgery that's same day. So you go home 6 hours after the operation average. In the last 2 years, only 2 or 3 patients out of 800 patients stayed overnight.
Mhm.
And they went home by 7 a.m. next morning. So this is the solution is simple.
Mhm.
So like when you are trying to go to the overseas, you have to take the plane or you can take the ship, and which is going to take a month, but then the plane is going to be 10 hours. So the bariatric surgery is a plane. It's a tool that makes it efficient, quick, fast, because we need that
Mhm.
immediate impact to get that motivation and the others. Not only that, in some ways, we know that we are not able to lose weight with and again, we are talking about morbid obesity. I'm kind of also hearing some of my dumbass friends who are kind of like, oh, like you can just work out. Yes, you can. But when you have morbid obesity, that's not enough. So that's why we kind of need to keep the focus on those who are struggling with this disease. And hopefully we can help more people and more patients. Um, Anything else you would like to add, Dr. Gill?
No, I just would like to say that, what we're doing here is really creating awareness and removing these misconceptions about the root causes of obesity. Yes, as a society, we need to do a lot more to prevent obesity from rising, right? And there are many things that as a society we can do. But we're here now where there are thousands of people who are struggling every day with morbid obesity that is really creating havoc in their health by illnesses like heart disease, high blood pressure, type 2 diabetes, and sleep apnea, and taking years off their life expectancy as well. So people are dying early also because of morbid obesity. And now we're also aware that many cancers are occurring as a result of the presence of obesity, that obesity by itself increases the incidence of many types of cancers. These are the leading causes of death in our society. So addressing obesity is extremely important. And this cannot be done in isolation by the person struggling by themselves. They need help, and we're here to do that, whether it's to counsel them, whether it's to guide them through nutrition, whether it's to offer the bariatric surgery. That's our expertise.
Absolutely. And next couple of weeks we'll be away. So we'll be back the second week of March with the live events, but there will be videos out there for the same time that we have. And again, we are extremely happy, at least. This is one of those rewarding situations where we do our jobs, yes, but it's also knowing that we have full impact, a positive impact in the society that we live in, being able to help those individuals. That's extremely rewarding, and hopefully we can do this for more people. Dr. Irgau, thanks so much for joining me for today's session, and then we'll see you guys soon.
Thank you, Kemal. Have a great weekend.
Bye-bye.